Hello everyone, and welcome to the Melanin Initiative. In healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language that you can understand. We create a safe space for you to ask your questions and for us to share our nursing perspective without taking too much of your time. Today's episode will be discussing hair restoration treatment for men. Please be sure to watch our previous episode titled Hair Loss in Men, which gives you an intro to our discussion on hair loss, as well as some treatment options that are mentioned there as well. However, in today's episode, we will be diving deeper into those treatment options. We'll be discussing hair Botox, platelet-rich plasma therapy, micropigmentation, surgery, including transplants like hair transplants and scalp reduction. We'll be discussing laser treatment, complications from these treatment options, as well as long-term maintenance. If you're new here, once again, welcome to the Melanin Initiative. I am Geraldine and I co-host the Melanin Initiative along with Alicia and Kimberly. We are a health literacy podcast offering our nursing perspective. When we say health literacy, we're talking about the ability to obtain information, to understand that information, and to use that information to manage your health and advocate for others. By watching on YouTube or listening on your favorite podcast app, we hope you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. If you haven't already, please subscribe so you can be notified when we release a new episode. Thumbs up the video and leave a comment or two. It helps us help you. It also shows YouTube that this content is valuable and helps to make sure YouTube shows our content to those who need to hear it. As a reminder, the show is for educational purposes only. The opinions expressed are our opinions alone, and they are not a representation of any of our affiliations. If you are experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you can call 911, and if you're having a mental health emergency, you can call 988 or text 741-741. So let's get started.
Wonderful. So as you know, here at the Melanin Initiative, we always start off with a definition. So today we'll be defining hair restoration, which typically refers to the medical or surgical methods used to treat various forms of hair loss or baldness. The goal of hair restoration is to improve the appearance of the hair by either stimulating hair growth or transplanting or moving hair follicles from one part of the body. So we're going to dive into our first treatment option, which is hair Botox. So hair Botox is primarily used to hydrate, nourish, and rejuvenate dry and damaged hair. It helps to reduce frizz and it adds shine and improves manageability. I feel like I'm advertising for a hair product. So the application process, the hair Botox product, which contains a combination of conditioning agents, keratin, vitamins, and sometimes argan oil or other nourishing ingredients, is applied evenly to towel-dried hair. It is left on the hair for a specified amount of time, usually around 30 to 60 minutes, to allow the ingredients to penetrate and condition the hair. Some treatments may require heat activation, using a blow dryer or a flat iron to help seal the product into the hair cuticle. And the last step is after the processing time, the hair is rinsed thoroughly with water. Hair can be styled as usual, and many people notice immediate improvements in smoothness, shine, and manageability. So as far as maintenance of hair Botox, to prolong the effects of hair Botox, it's recommended to use sulfate-free shampoos and conditioners and avoid excessive heat styling, which is generally good in general. It's good advice. Some side effects of hair Botox is skin sensitivity. It is a possible side effect. And like any cosmetic treatment, individuals with sensitive skin or scalp may experience irritation. So it's essential to perform a patch test or a consult with a professional stylist. And in that patch test, they'll just take a small area, they'll test the product in that area, look to see if there's any reaction, and if there is none, we can proceed with the full treatment. For considerations, so temporary results as the effects typically last for several weeks to a few months. depending on the product used and the individual hair type. And we talked a little bit about specific hair types in our hair loss episode.
And that link is in the description box. Now we'll talk about platelet-rich plasma, otherwise known as PRP. This is a non-surgical medical treatment option where we take your own blood, spin it down, and then we will use we'll place a numbing agent to the scalp to make it a little less comfortable. And then we'll use a fine needle to insert into your scalp to inject the PRP or the serum. That takes anywhere from 30 minutes to an hour. You'll be advised to avoid washing your hair for a day or two and to avoid strenuous activities for a short period, as well as you might be told to stop certain kind of medications. Benefits, it's minimally invasive, natural treatment, less because we're using your own blood, less risk of you having a reaction, and it can improve your hair density. Side effects include the pain and discomfort, which is why we're applying that topical numbing agent. And then swelling and bruising, which will easily go away after a few days or so. And make sure you discuss with your provider and how you can address that too, especially if it is if you have to go to work or you have to do something that causes you to be embarrassed about the bruising. And then you might have an injection reaction at the site where the needle is inserted. It's rare, but it can happen. Then things to think about, you will need multiple sessions in order to get the optimal results. Periodic maintenance may be necessary to sustain the benefits. Just to keep in mind, PRP therapy is the most effective during those early stages of hair loss or hair thinning. It's not effective if you've had extensive hair loss or baldness, and extensive in terms of the severity as well as the length of time.
Hi, I'm Alicia from the Melanin Initiative podcast. Our mission is twofold. One, to simplify complex health information so you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. And two, to elevate the expertise of nurses, spotlight the diverse career opportunities within the healthcare industry, and inform our peers how to leverage their expertise as clinicians and entrepreneurs. In less than 2 years, we've grown to over 50,000 views and 1,000 downloads, with an international audience spanning the US, Canada, the UK, Australia, and more. Our engaged listeners are professionals, entrepreneurs aged 25 to 44 who value authentic, impactful content. Want to connect with this dynamic audience? Advertise with us. Send in your 1-minute video ad and let's amplify your brand. Email tmi.melanin@gmail.com for rates and details. Let's work together.
So another form of treatment is micropigmentation. Micropigmentation for hair restoration, which is also known as scalp micropigmentation, is a non-surgical cosmetic procedure used to create the appearance of fuller hair. It involves the application of natural pigments to the scalp to replicate the look of real hair follicles. The procedure involves, the way that it works is that the process begins with a consultation, of course, to discuss the desired outcome. It allows the provider to assess the scalp and plan the treatment. The practitioner selects the pigments that match the natural hair color and skin tone. And using a fine needle, the provider will deposit tiny dots of pigment into the scalp's upper dermal layer, or the upper skin layer. The dots mimic the appearance of hair follicles or short hair strands. So we were talking about this before. It's pretty much similar to what people get, like basically the eyebrow micropigmentation that a lot of people are doing nowadays. It's similar, it's just on the scalp instead of the eyebrows. The benefits of micropigmentation, immediate results. It's non-invasive and there's minimal downtime. So because this is not a full-on procedure, so minimal downtime for that, and it's long-lasting. It also another benefit is that it creates the illusion of denser hair for those with thinning hair. So although it doesn't necessarily grow the hair necessarily, it just provides the appearance that there's flow of hair. It redefines and strengthens hairlines, and it conceals scars from injuries or previous hair transplant or hair restoration procedures or surgeries. It also provides coverage for areas affected by various forms of alopecia. Some considerations for micropigmentation. It will require multiple sessions, usually 2 to 4, and they're typically, usually 2 to 4 sessions are typically required to achieve the desired density and coverage, and each session can last several hours. So depending on the, especially depending on the extent of the treatment area, so those are things to consider. Proper aftercare is also very essential to ensure optimal healing and longevity of the results. This includes avoiding sun exposure, excessive sweating, and following specific care instructions provided by the practitioner. Some risks for micropigmentation treatment is, as with any cosmetic procedure, there are risks including infection, allergic reactions, and unsatisfactory results. However, these are minimized when performed by a qualified professional.
Thank you. All right, so I'm going to talk about surgery options. So we've talked about this a little bit before, but there is an option to get different kinds of transplants. So the first one I'm going to mention is follicular unit transplantation. And that is a strip of scalp is removed from the donor area, and that area is usually the back of the head, and individual follicular units, or like sections, are extracted and transplanted to the thinning or balding area. So we're removing it from the back of the head and then transplanting it to the part that's thinning and balding.
Exactly.
Then there is follicular unit extraction, and that is individual hair follicles, so the individual pieces, are extracted directly from the donor area using a small punch tool and then transplanted to the thinning or balding area. So the first one was a strip, and the second one is a little more, it's smaller unit, so it's an individual unit. The third type of transplant is a direct hair implantation. It is a variation of the one I just mentioned with the unit specific transplant, where hair follicles are extracted and immediately implanted into the recipient area using a specialized tool. This method aims to reduce the time the hair follicles are out of the scalp, which potentially increases their survival rate. And another type of surgery is called robotic hair restoration. And this uses advanced robotics and imaging technology to assist in the extraction and placement of hair follicles. This method can increase precision and reduce human error, often leading to more consistent and natural looking results. I also want to mention scalp reduction, which we've also mentioned in our previous episodes, and that involves the surgical removal of bald areas of the scalp and then stretching the hair-bearing areas, or the areas that have hair, to cover the excised area or the area that was removed. This method is less common. I can agree. I don't think I've got that, but it's less common due to the potential of a significant scarring and other complications. So as far as complications, side effects, and other considerations for surgical options, these are kind of standard. Whenever you get a surgical procedure, we're always concerned about infection or bleeding, scarring after it begins to heal, an anesthesia reaction, pain at the treatment site, numbness, tingling, an unnatural appearance, or whenever you get a transplant, there's always kind of a risk of that the site that's receiving the area fails, and it doesn't actually take those new cells. That's the word I'm looking for. Yes. So yeah, that's a complication that could occur.
Okay, and then the last one is going to be laser treatment, also known as low-level laser therapy, where we use a red or near infrared light to stimulate the hair follicles. The light will penetrate the scalp, promoting blood flow, which we talk all about here, and cellular activity in the hair follicles to stimulate that growth phase again. Treatments can be administered using in-office devices, handheld devices, or wearable things you can wear, like a cap or a helmet. Benefits are it's non-invasive, so there's no slicing. It's generally considered safe with minimal side effects, very convenient as there are home options that you can purchase that allow for easy and frequent treatment. Some studies show that low laser therapy can increase your hair density and thickness in men, specifically if you have the androgenetic alopecia or the male pattern baldness. Things to keep in mind: regular and long-term use is necessary for optimal results. Your results may vary and often requiring a combination of other treatments such as topical minoxidil or finasteride to enhance your results. And while non-invasive, low laser light therapy devices can be a little bit expensive, as with most cosmetic treatments in general. And so that is going to be just a personal decision and investment. But a lot of times these clinics, especially, they offer sales throughout the year, and they'll let you know if you're really interested. That wraps up all our treatments.
Yeah. So as far as vulnerable communities, in this episode, we in the beginning, we definitely talked about the title of the episode is hair restoration for men. However, a lot of these treatments can also be offered for women. So just always make sure that you are discussing your options with your healthcare provider, because oftentimes there's some overlap with the treatment. Race, it affects all races, I would definitely say.
One thing I do want to point out that I didn't mention in the hair loss episode, when you're trying to do that diagnosis of hair loss, because you can experience so many types of hair loss at one time, particularly when it comes to skin or color patients, we really recommend that you get a biopsy so that you can have a definitive answer. And then it's important to note that not everyone who is in dermatology has extensive training or comfort when it comes to skin of color. And that's just because we really don't have enough of it in our education, whether it's medical or nursing. So we're not getting it from faculty. We don't get it in textbooks where the images are of a range of skin tones. And so it really, and it's not required to maintain licensure or certification. So it really is the onus of that provider to have an interest and to invest in the time to learn. And so the only way you're really going to know if they have that level of education and comfort is to ask.
Right, and also continuity of care is also a main theme that was mentioned throughout this episode as well. Some of these treatment options does require follow-up and close, working, like a good working relationship with your healthcare provider to determine what treatment options are best for you, as well as when you should return for follow-up if that is needed.
One thing I just wanted to call out, I think we mentioned it, briefly with laser therapy, but hair restoration treatment options could definitely have an effect based on your socioeconomic status and what you can afford, what your insurance will cover. Insurance doesn't always cover cosmetic things, so it's important to just, have a conversation with your provider, see what could be covered with insurance, and then if there is going to be an out-of-pocket payment, what is that going to look like? Is there a payment plan? Do you have to pay it all up front? What is that going to look like for you? Because, it can be expensive. So definitely when you're on your journey, do what's best for you.
And that's where prevention really becomes so much more valuable, because prevention is always cheaper than treatment or cure.
Absolutely.
And so that's what we're trying to do here, is to help save you some coins and time at the office or hospital. Anything else anyone want to add?
No.
Well, everyone, today we talked about hair restoration options. This is a follow-up to our episode on hair loss in men, and we talked about all the options that are available. We discussed the benefits, risk, maintenance, follow-up, which I think if you're going to make that investment and you go to your consultation and you find out you're going to need to do these next things for the next 3, 6, 12 months, and maybe you're a traveler, you're all over the place, you're a caregiver, you're starting a new job, that maybe now's not the time, because it's an investment, right? And
money and time.
So just talk about it, and you never know, they might be able to work out something with you. We don't want people to feel like some things are only for some people.
Right.
And a lot of times that's just because we don't know.
Right. You have to ask.
Yeah. And that's exactly what I said. All options are not suited for everyone, so it's just important to speak up. And hopefully we've given you some language today to educate you and empower you on how you can manage your health and navigate the healthcare system. Remember, you can email us your questions and show ideas to tmi.melanin@gmail.com. If you haven't already, please subscribe to our YouTube channel, connect with us on LinkedIn, and follow us on every social media platform. Subscribe to your favorite podcast app. If that happens to be Apple or Spotify, please leave a comment and leave us a 5-star review. Let us know how we're making a difference. Any questions you have, share the show with your friends and neighbors, your students, because while we do talk a lot about health literacy, we also like to promote the voice of nursing and elevate the platform of healthcare. There's a lot of ways you can be part of the industry, a lot of ways you can impact people, because everyone always says, I just want to help people. There's a lot of ways you can do that. And while being a doctor and a nurse are really great and satisfying careers, there's a lot of options out there, and we want you to know about them. We release new shows weekly on Sundays at noon Eastern on YouTube, LinkedIn, and all your favorite podcast apps. And that's a wrap. Thank you everyone for watching. We'll see you next time.
Bye-bye.
Okay.